coding query best practices. There is a right way and a wrong way to query your physicians. Query providers when information is missing or unclear. Now, maybe it's unclear because you don't understand the disease process or you don't understand the verbiage that the procedure is detailing and you can't find it to match up for a proper translation. Or the provider just didn't state it and they need to state it for you to be able to get the specificity that you need or show that medical decision making. Use compliant and standardized query templates for accuracy. Super easy to do. Now, I would suggest best practice would be to sit down with the team, and that would include the coder, maybe the CDI person, the compliance specialist, and the clinician, physician, or provider, and come up with a template. How does that clinician want to be asked questions? Do they want yes or no questions? Do they want bullet points? Do they want fill in the blank? How do they want and what how they want it done and what's the easiest for them? Do they want it on a piece of paper? Do they want it in their email? Do they want it in the program, the software that you're using? It has usually PHI on it, so you've got to be very careful in the way that you do that. Now, once everybody is in agreement how you're going to create that little template, then that's what you stick with. And that's what the clinician will be used to. That's way you just fill in the blanks and what needs to be clarified, and the process runs very smoothly. Keeping it standard and writing it down in your compliance notebook. These are the two formats for queries that we've adopted in our practice, and everybody signs off on it. Then you know you're covered if anybody doubts your practice. There are a few different types of queries. You have a concurrent query, which is during patient care and documentation. That, uh, again, there could be multiple reasons why you need that done at the time. Sometimes coding is being done and charts are being accessed before the chart's even signed off on. And you could be working on different types of audits to create best practices or a protocol. Retrospective queries are after the patient's discharge or visit. The patient left, but guess what? You aren't sure if they are a active smoker or they're a smoker in remission, or is it abuse? Is it addiction? There's lots of things that you could get clarification on. And then prospective queries are before services are provided. So you're going to start a new procedure that's offered in your office that wasn't available before. Maybe you're going to start offering echoes, cardiac echoes, and you have a room set up. You've got your technician, the cardiologist is on board. They're ready to start doing those echoes, and the cardiologist is going to read those there as well as send them off. And you need to have a process to make sure all the protocols and steps are in place so that it goes smoothly. And you need to have a process to make sure all the protocols and steps are in place so that it goes smoothly. And if you don't want to have denials, that the documentation or what processes need to be done before you can bill out. And that could also include authorizations and stuff.